Dr. Sebolelo Seape is president of the South African Society of Psychiatrists, joining us to talk about this conversation. A very good evening to you. Thank you so much for speaking to us, Dr. Seape. Perhaps let's start with the Congress itself, the importance thereof, and who attends it to what end?
Good evening, SABC, and thank you for having me. The conference is a biannual conference that the Society of Psychiatrists holds, clearly every 2 years, and it is usually mostly psychiatrists, but we need everybody working in mental health. So it would be psychiatrists, it would be psychologists, occupational therapists, psychologists, social workers, nursing, and this year it's slightly different because I think an extra effort has been extended so that we include all the other role players in mental health provision and care. So we've made sure that we're including patients, we're including advocacy groups and other organizations that work in mental health.
So as I mentioned in the introduction, that you're pushing for interventions that will ensure that delegate healthcare services rather to less specialized health workers on community level. Can you please expand on that for me? Because it sounds somewhat confusing. Mental health care to me sounds like something that is delicate, that actually needs somebody or people who are trained and understand it. So why push for less specialized health workers?
Okay, yes. Yes, of course, we are not saying that we will do away with all the doctors and the specialists. No, we won't. But the mental health care team is actually a very big team. Yes, it is very delicate, it's very important, and it can be done by the doctors, but it is not enough. As we already know, there are hardly 600 to 800 working psychiatrists in South Africa for the population of 62 million. So already we know that they aren't enough, and therefore the services will never, cover the population. So we need all the help we can get. And although the doctors are there, yes, and the psychologists and all the professional teams, but the team doesn't end there. The family is part of the team. And they don't have to be doctors because they are the ones dealing with the person who's been diagnosed with an illness, and they are the one having to look after them. And therefore, they're part of the team because we need to be there to support them, to keep them informed, to help them if it's necessary, and to help them guide them towards resources. And beyond that, there's also advocacy groups which do a lot of work in terms of getting the word out, picking up what the problems are. And of course, we're dealing with what we call the patient, the people who've been diagnosed. It doesn't mean that because we are the doctors, we know everything, and it doesn't mean that we know what they need and what will serve the best. So they have to be included in the team so that they can say, no, this is not a necessary move, rather do this, or this is what we need, and please provide us with this. And of course, one big thing, as you might know, is information. Not enough people know enough about mental health. And all of us, including you, Tsepiso, are part of the mental health care team because we're able to disseminate information.
So to frame it better...
What needs to be done? Mm-hmm.
So to frame it better, what you're saying is you're not saying take away mental health care away from specialized doctors, but what you're saying is expand...
Not at all.
Expand and have a more holistic approach.
Definitely so.
Okay, so just looking at your theme, shifting the paradigm towards community health and unheard voices in mental health, that's also part of the strategy of what you're explaining now.
Yes, it is. The paradigm has been very focused on high-level intervention, specialist care, and but not everything needs that. The focus has been on the 1% of severely ill diagnosed mental health patients. But the people who are suffering mental health is a wide spectrum. And a lot of it doesn't need the specialist doctor. There's a lot that can be both, in fact, from just picking up patients to prevention, to diagnosing, to making medication and clinic care accessible. That doesn't need high-level medical intervention. That needs far lower. And in fact, as we should be looking. We should be looking at lay people, because they are the ones who know the people in the communities, who can bring them up. And if we empower them and upskill them to be able to recognize minor illnesses, or maybe just recognize a family that's got a genetic predisposition, and therefore bring it up so that they can get, because early intervention is very, very important. It would cut down the burden of mental illness by a great percentage if we were able to access and intervene early. And that doesn't need a specialist doctor. It can be done by lay people.
So just looking at your summit and the workshops you'll be holding, I want to focus particularly on the future of psychiatry in South Africa. What are you hoping for in terms of the outcomes and the discussion, the range of it?
We are looking at and hoping to get contributions from other parts of the world, from other people, and in fact, we must learn to listen closer and harder to patients, to communities, to families, to advocacy groups, and collaborate with them. We're also hoping to learn from other parts of the world what they're doing in terms of how do they get mental health services to reach further. We also want to look at how do we decrease stigma, because it is really one of our biggest enemies, and that keeps mental health stats very, very high because of the stigma. People don't present, and if they do present, they don't come for follow-up. If they do, they don't take medication. All those factors that make mental health less, make it more difficult to conquer. I'm not thinking that we are ever going to conquer, but at least we can reduce and we can increase access. And we can increase use of medication where it is necessary, and where medication is not necessary, for people to be comfortable to seek therapy and abide by the therapy. So that's what we want to do. We want to get to the community so that they feel that they are part of the system, because they are part of the system, and they can be upskilled, empowered, taught, and they can join. We can all join hands to try and alleviate this burden of mental health.
And just finally, is the conversation improving, the quality thereof, when we talk about mental health amongst ourselves in South Africa? As you say, everybody has some form of experience and is therefore empowered to deal with mental health issues or patients, but is it a progressive discussion?
This is an ongoing discussion, Seape, so it will always be, and it should be, because as we're saying that there are more and more interventions that we either are aware of or we should improve on. As you know, that there's a lot in the past to people, and people are also consulting via technological means. So there's all that. And even as I said, because we have, the conference will include international, African international contributors, we might learn new things or new skills, how they are dealing with their mental health burden, in terms of how are they reaching more numbers, how are they able to keep people in treatment, how are they able to disseminate the information, So it will always go on, and there will always be new things. And of course, we know the normal one is that medication is improving, getting better, and there's new medications all the time. We need to share that as psychiatrists. We need to teach our patients about that. It's important also that patients should always know, and families should know what they're taking. So it's a discussion that will not die down and should not be allowed to die down.
All right. Thank you so much for speaking to us. Much appreciated, Dr. Sebolelo Seape, who is speaking to us on behalf of the Society of Psychiatrists in South Africa, the Congress that they have coming up next week. Thank you very much, Dr. Seape.